Asthma basics. Asthma is a chronic disease of the airways that makes breathing difficult. Asthma can be challenging, disruptive, and frightening for those who have it and for family, friends, and caregivers. Asthma is different for everyone, and its symptoms and onset varies greatly from person to person. There is currently no cure for asthma, but with the proper treatment, people who have asthma can live normal, healthy lives. In this section, you will find resources that you can trust that will start you on the path towards learning more about asthma, how to manage it, and live well with asthma. What is asthma? Asthma is a chronic disease of the airways that makes breathing difficult. Asthma causes inflammation or swelling and a narrowing of the airways, making it more difficult to breathe. Irritated cells in the airways make more mucus than usual, narrowing the tiny airways. Mucus is a normally protective, sticky liquid that helps shield your lungs from irritants like dust and bacteria, as well as smoke. During normal breathing, air flows freely in and out of your lungs. However, during an asthma attack or episode, swelling of the airways lining increases. Muscles surrounding the airways tighten, and thick mucus clogs the tiny airways, making it difficult to breathe. Who gets asthma? Asthma affects people of all ages, and while it can start in adulthood, it most often starts during childhood. Young children who wheeze a lot and have frequent respiratory infections that continue beyond 6 years old are at a greater risk. Genetics can also play a role in developing asthma. Having a family history of eczema, allergies, or having parents or siblings that have asthma increases risk. We aren't exactly sure what causes asthma, but we do know exposure to certain things can trigger an asthma attack. Asthma symptoms vary from person to person and can flare up at any time, day or night. Symptoms may include wheezing. Wheezing is a whistling or squeaky sound when you breathe out. Coughing. Coughing from asthma is often worse at night or early in the morning, making it hard to sleep. Sometimes coughing can be the only symptom. Shortness of breath. Some people feel like they can't catch their breath or feel breathless, as if they can't get air out of their lungs. Chest tightness or pain. This can feel like something is squeezing or sitting on your chest. Asthma symptoms vary from hour to hour, day to day, week to week, and over months, and can vary from mild to life-threatening. There is currently no cure for asthma, but it is manageable with proper asthma medications and by avoiding common asthma triggers. Having symptoms may mean your asthma is not well controlled. See your healthcare provider if you have symptoms or are using your quick relief inhaler more than 2 times a week. You have symptoms that wake you up 2 or more times a month. You refill your rescue inhaler prescription more than 2 times per year, your asthma is getting in the way of your usual activities like going to school or work. Don't ignore your asthma symptoms. Symptoms that are not easily relieved by using a rescue inhaler or that reoccur should be evaluated by your healthcare provider, or you should go to the emergency room or call 911. Take asthma seriously. There are many different things that trigger asthma in the home, school, and work settings, and there are ways you can reduce your exposure. Triggers may include pollutants in the air we breathe, pollen, wood, smoke, cold air or weather changes, viral infections, chemicals and scented products, strong emotions, aerobic exercise, and many more. What may trigger a person's asthma is very specific to that individual. Some of the more challenging asthma triggers can be found inside the home. These include dust mites, tiny spiders that are found in almost every home, mold, tiny water leaks, and humidity. The amount of moisture in the air can allow mold to grow. Dander, saliva, and excrement from furry or feathered pets like cats, dogs, and birds. Pests such as cockroaches and mice. Sensitivity to triggers varies greatly from person to person. It is important for asthma patients to talk with healthcare providers to understand what triggers may cause their asthma to flare up and learn ways to reduce exposure or eliminate triggers as much as possible.